8:35. David Stokes is with us, policy analyst with the Show Me Institute. How long have you been doing this show? It's got to be 3 or 4 years.
Well, I think I've been doing it every Monday for about a year and a half.
No.
Yeah, but I was on.
Yeah, you were on.
I was on with some degree of frequency for a year or two before then.
Really? It's only been a year and a half or so?
Every Monday,
it feels
I think
like
so.
longer.
No. I'm just saying, it's time, because I know Kat Neville. You look at Kat Neville, she's been on like 7 years.
Really?
Yeah. So, I mean, she looks the exact same the day she walked in. You look like 3 years older, so I figured it was at least 3 years you've been doing the show.
Well, I thought I started looking younger when you initiated this video bit, and I started to have to shave.
You do look younger
we have
on
makeup
video.
people here for you.
That is correct. David Stokes, you've been wanting to chomp at this topic for a while, and pressing news has always sort of kept us from doing it. You want to talk about the Affordable Care Act, and you are upset, or you have an issue with some of the policies that are being offered by the exchange.
Well, I have an issue with you mostly.
Well, go ahead.
No,
well, your wife has an issue with me. You
No.
don't. Your wife does.
Kidding there, of course,
Yes.
McGraw.
Yes.
Look, the Affordable Care Act, I don't like it at all. And I had a letter to the editor in the West News Magazine and the Mid Rivers News Magazine a couple weeks ago, which explained in a little bit more detail some of the objections. And one of the things I object to is the making it more difficult to sort of have these high deductible, lesser coverage policies.
And they're called catastrophic plans.
Right. That's
Which
the
means
common
what
name.
exactly?
That basically you have a $5,000 deductible, maybe even higher in some cases.
Right.
And you pay everything basically up to that deductible.
Right.
Your first $5,000 a year or more is all on you, and then anything beyond that the insurance covers generally at 100% or at a very high percentage.
Right.
And for that you pay a lower monthly charge.
Right.
So, and that's what I had, and those are the types of policies that were canceled all across America.
Correct.
For a couple million Americans starting a month or so ago.
Correct.
And one of the problems that I have with this is that those are the types of policies we should be encouraging people to have, and not just for the low cost part. We have a paper at Show Me Institute that we released a few years ago about how the third party paying system leads to an increase in medical costs. The only reason the ER visits for uninsured people isn't the only reason why we spend so much on health care in America.
Right.
It's a big problem, and it's one that the Affordable Care Act, that might be one of the parts it actually addresses. But there are other reasons we spend so much here. There's litigation, and even beyond litigation is defensive medicine that doctors do to ward off potential litigation. And related to the defensive medicine is how because so many people who do have insurance don't really pay for it, it's subsidized by their employer or whatever. Every time you get sick, you want the best of everything, and you want it now.
Mm-hmm.
You want the CAT scan because you bumped your head and you have a small headache.
Right.
Even though the CAT scan's probably not necessary. And one of the reasons we all do this is because most Americans are disconnected from the cost of their health care. There are ads running, I believe, on this station and many others saying it's the end of the year. You haven't used up all of your insurance benefits.
Right.
Go to the doctor now. Go to the dentist now. While you still have, even if you're not sick.
Well, right.
And to the extent that some of that might be necessary preventive care, that's a good thing.
Right.
But to the idea that it's just somebody says, well, I've spent the money for the insurance, I might as well use the benefits. That's why we spend so much on health. It's one of the reasons.
There's so much here that I agree with, and we might differ on some of the things, but I agree with you on lots. I think we are truly disconnected from our insurance costs. We don't realize how much our insurer actually pays each one of our, right? We see the $25, $50 taken out of each check, and we think our insurance costs $50. We don't understand the company is picking up 75, 80% of that cost each month, just like Social Security. We pay 6%, but the employer pays 6% for every single person that they hire. So I agree with you on that. There is a disconnect. We also should be charging more for smokers, for overweight people, for choosing to live an unhealthy lifestyle. Fine, you're a bad driver, you're gonna be charged more for your car insurance. You're a bad eater, you choose to live unhealthy, you should be charged more. So there's a lot we agree with there. In terms of the catastrophic plan, I don't disagree with you on that. And I looked at the Federal Exchange, and there are no catastrophic plans offered for Missouri residents on the Federal Exchange. The state of Missouri could have created their own exchange and created some of these catastrophic plans that you talk about, but the state chose not to. So that's just, the state very easily can solve this problem, can't they?
Well, I think those catastrophic plans, though, are going to cost more than they otherwise would, because now they're required to cover things that they shouldn't be required to cover, such as maternity care for people in their 50s or 60s.
Now this is,
but there are plenty of other examples beyond just that maternity care. Is that, yes, they're offered in Missouri. It's not that these plans are completely illegal. It's just I saw from my family plans canceled and then put into new plans at much higher cost because they are now required to cover things that as of a couple months ago they didn't have to cover.
Right.
And that's why it's now very, very comprehensive catastrophic care.
But insurance only works if everything's covered. So I don't have anybody in my family who has hemophilia. So why should I buy insurance to cover hemophilia? Well, that doesn't work because the person who does have hemophilia, they can't afford the hemophilia shots every day, so it's subsidized by the rest of the insurance pool. But you know what? I might get cancer, so I want to buy that. You can't. Insurance is not a la carte. It's everything. And in Missouri, we know that autism, and this is my argument for years now, autism was a pre-existing condition. And the Republicans, along with the Democratic governor, forced the insurance companies to cover autism as a pre-existing condition. I don't have any children who have autism. Why should my insurance cover autism when I don't have any autistic kids? At some point, they're going to get around to something that I might have at some point. I'm not going to have a hysterectomy, so why should I pay for that? I'm not going to get pregnant, so why should I pay for that? At some point, we're all in it together, and insurance only works when everything's covered and everybody's paying for it.
Well, those are great points. There are many types of insurance that, in fact, are a la carte. I mean, to broadly say insurance isn't, I mean, we look at the other types of insurance out there. Auto insurance, where you're only legally required to get liability, but you can, flood insurance, you don't have to get it if you're not in a floodplain. Life insurance, you're not required to get it at all. In fact, you might choose to, you might choose not to. So there are plenty of types of insurance out there that work just fine without requiring everybody to get everything. Now, health insurance may work better if you do it that way. Mm-hmm. But I think it's erroneous to broadly state that insurance has to work this way. I think there are plenty of options within healthcare to allow for people to get a more tightly constrained policy that costs them less. And there's nothing wrong with that covers less, and that might exclude a few things that are less likely to happen. And then you go with the risks of that as a healthy 20-something, and then you pay for your insurance costs as you go. One of the benefits of these plans is when you have to go to the doctor, if you're young and healthy and you don't pay much each year, what comes out of your pocket helps make your choice in how you're spending it. And that's what will help constrain total costs. We're going in the opposite direction where now everything's covered for everybody. And even though it will have the benefit that you just described to protect us all, maybe a little bit better, and I don't think it's the government's job to protect people, but that's another argument.
Right.
You're still going in the wrong direction for lowering costs on medical care in America.
I don't know about your insurance plan, but I know when I was out of work, I bought an insurance plan, which I would have found out would be deemed illegal now because it was a 3-month plan. It was a stopgap between jobs. And so I bought it, and it was good price. It was $90, $90 a month. It was worth it. $90 a month. What are people complaining about? Turns out that it was 3 months, and at the end of 3 months, if I got cancer, they were going to cancel me, and I didn't have insurance. That plan would be deemed illegal today. That plan should be illegal. I was being sold a bill of goods by that insurance company because I was under the false pretense that I had insurance. I only had insurance for 3 months. So a lot of these plans that are being canceled, and again, I don't know your plan, but many of them are these sort of plans where you're buying peace of mind because you really weren't insured and you were going to be dropped or changed or canceled the minute a real issue came up where you needed insurance.
Well, the changes in the Affordable Care Act that relate to making it tougher for insurance companies to cancel you, what you've got, those are the changes that I think everybody agrees on. And I think we could have enacted those as part of a free market healthcare reform in America without the over-the-top Affordable Care Act, Obamacare legislation. That is the type of change. Again, I think we'd all agree that if you have insurance, you shouldn't be able to be canceled if you get sick. And then, you would have had to have hired a lawyer and fought it, and you might have been successful at that.
Right, but who's got money to fight a lawyer?
You shouldn't be forced to do that in the first place. But I do just want to repeat that this idea that we're now all into the pool and we're all covered for everything. On healthcare, now more people say, "Well, I'm covered for everything. It's the end of the year. I might as well go to that doctor's visit, even though I'm not sick." And again, where that comes in with preventive care, that might not be so bad. But when it comes to getting the CAT scan because you have a headache, I mean, that's how one of the reasons we spend so much on healthcare in America.
I was going to say it is good for preventive care. I mean, it may be good for people who don't normally go to the doctor, and it's a great opportunity for them to actually go and get their yearly that they probably wouldn't do, and maybe find something wrong with them. Who knows?
Well, but there's a lot to be said for preventative care. There's a lot to be said for living a healthy lifestyle. I think there's a lot here. Insurance companies will tell you we can't drop pre-existing conditions unless everybody buys insurance. Every insurance executive will tell you that, because the minute I get diagnosed with cancer, guess what? Now I'm going to buy the cancer insurance. So insurance doesn't work that way. I'm not going to buy pregnancy coverage or birth coverage or whatever because I'm single and all of a sudden I knock somebody up. You know what? Now I want it. So now I'm going to buy it. Insurance doesn't work that way. And every executive will say it will go broke tomorrow. So you have to force people to buy it, and you have to force people to buy everything, or it doesn't work. Seniors, they all get glaucoma. They all get diabetes. They all get, this and that. So it's easier for them. And yet also, I'll finish with this, and I'll give you the last word, David Stokes. You were talking about commercials on the station about, hey, your deductible's finished. Go to the hospital before the end of the year. There are commercials running on this station and others saying, hey, you know what? Sign up for Medicare Advantage. We'll pay your health club dues. So I don't see too many people complaining about the seniors having their health care dues subsidized by the rest of us.
Well, I'll complain. I'll complain.
All right,
about
good.
that.
So we'll end on a positive note.
No, it's gone. In my opinion, and we've got a lot of stuff at showmeinstitute.org on healthcare. Patrick Ishmael, my colleague, is our healthcare policy analyst and does a great job on it. There are more free market oriented ways to connect people to the cost of their own healthcare. And you talk about pregnancy. Well, most pregnancies are planned. I mean, it's not a.
I would disagree with that.
I think most pregnancies.
I think you're living in the.
I think 51% are planned.
I think.
And what's more, a pregnancy doesn't bankrupt you if it's not planned. People can pay more of the cost of their own insurance without having to basically mandate everybody have absolutely everything.
I think you and I are a lot closer to this than we think. We're in more agreement than we are in disagreement, one. And two, I truly think I'm more of the conservative point of view on this than you are.
Well, it's always good to be more in agreement with than you think with the host.
And just talk a little more, and maybe you'll even become
no more
agreement.
common ground. There's enough common ground here. David, when can we read you? When can we see you?
Well, everything we write on healthcare is up at showmeinstitute.org, and you can follow me on Twitter at David C. Stokes.
We did something that you very rarely hear on radio, which was a informed, interesting, and informative conversation about healthcare. So we'll try to do better next time. We apologize for that.
Now let's go and just eat like gluttons over the holidays.
Ladies and gentlemen, David Stokes. Merry Christmas. Happy New Year.
Merry Christmas,
Cheers.
McGraw. Merry Christmas, Kelly.
8:50. We'll talk to Mike Kelly next, the Big 550.